Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Hey, good morning. I'm Steve Jones. I direct the Center for Cardiometabolic Science, and we just came out of medicine grand rounds here at the University of Louisville. Today we had Dr. Helen from our center, and she's going to give you just a quick recap of what you missed.
Okay, so I discussed today that being pregnant in the United States is very dangerous. We see that the maternal mortality rates in the US are above those of all of the other developed and developing countries, and that in fact in the home state of Kentucky, these rates are significantly increased over the national average. And we also discussed that there's many risk factors that precipitate this maternal cardiovascular disease, such as advanced maternal age, also successive pregnancies, lactation, also those changes which could impact cardiometabolic health, such as obesity and diabetes and poor nutrition. And then we discussed the need in Kentucky, but also the US, to reduce the maternal mortality rates through providing improved care to women during pregnancy and increased education, and also that we need to do better at reducing the racial disparities associated with pregnancy adverse outcomes. And in terms of my research that we discussed, I showed data that we have in the lab that shows that during pregnancy the heart enlarges, and this is a normal enlargement of the heart which is associated with pregnancy. And we see that this is associated with changes that are consistent with a normal physiological hypertrophy or enlargement of the heart, and that this was also associated with temporal changes in different cellular constituents of the heart, and also that during pregnancy there's significant changes, especially at late pregnancy, in cardiovascular metabolism, specifically reductions in glucose metabolism, and that we see changes in ketone body metabolism increases during this time, which facilitate metabolism during pregnancy, whilst this glucose is being diverted towards pathways associated with cardiac growth. And then we just briefly touched on the impact of lactation on the reversal of this cardiac growth during pregnancy, and found that it has a pro-hypertrophic or pro-growth effect. And so future studies will investigate not only the changes in ketone body metabolism in the maternal scenario, but also to investigate some of the impacts of lactation on the maternal heart.
Great. Thank you.